Welcome to the PCR studio. My name is Dr. Rodney De Palma. I'm from the UK, currently based at the Karolinska in Stockholm, Sweden. And today I have Dr. Hendrik Treede from the Hamburg University Centre in Germany, who's going to tell us a little bit about a new study that's come out called BIOVALVE I. Dr. Treede.
So thank you. The BIOVALVE I study dealt with a new transcatheter technology. It's a self-expanding nitinol-based valve. It's the porcine pericardial valve, soon on a nitinol stent in a supraannular position, and was evaluated in this first-in-man trial. It was a single-center trial performed in Hamburg on the heart team. I'm the surgical head of that heart team in Hamburg for the structural heart diseases. And together with my colleague Ulrich Schäfer from cardiology, we performed this trial in 13 patients actually. And within that trial, we were able to implant in 11 patients the so-called BioValve from the company Biotronic. And this valve has shown very nice and promising results in this trial. And this trial will be followed, of course, now by a CE mark trial.
And what are the special features of the design of the valve itself? It's a self-expanding valve?
Yeah, it is a self-expanding nitinol-based valve that, looks a little bit like other valves in the field already. One of the special features about this valve is that a very nice delivery system that allows for retrievability and reshippability of this device up to 80% of deployment. What really makes this a safe procedure, because it allows you to reposition the valve easily if you do not have a sufficient result with the first position, and then you would only deploy it in the perfect position, perfect height, before you then go off patient.
And the cases were all done transfemorally, I believe.
Yes.
And what about the actual performance during the first-in-man? Were there any conclusions drawn from that?
Yeah, we have been positively impressed by the first-in-man study results. So basically, we can pretend we wrap it up, but there was no MACE at all. All patients were survived. There was no stroke. There was no myocardial infarction. So from a safety point of view, also no coronary occlusions, this valve worked very nicely. Then in terms of valve performance, we had 20% of patients that ended up with a moderate peripheral leak at discharge that then went back to 10% at 30-day evaluation. So there was an improvement in one patient that had moderate after implant that went back to mild after 30 days. So it's typical for, as we know from other devices and self-expandable devices, that there may be an improvement over time. So altogether, 90% at 30 days that did have either no or only mild PVL. That was quite good in our eyes. And also the ease of use during the procedure was quite impressive due to this very nicely designed delivery system.
And just to clarify, the population was severe degenerative calcific aortic stenosis?
Yeah. It was a typical TAVI population. Nevertheless, if you look just at the STS scores and logistic Euro scores, you would call them intermediate risk. But the mean age of the patients has been 84 years, so I think this is now a typical TAVI population that we would regularly treat also with non-investigational devices with TAVI.
Okay. And are there any plans for any future studies?
Yeah, this study was, of course, only the first-in-man trial. It was more or less based on the safety issues, and now this will be followed by the so-called BioValve II study, what is the CE mark trial. And then once the valve receives CE mark, there will also be a registry for those commercially implanted valves that would then account and deliver data on a very large patient population.
Great. Well, thank you very much. I look forward to seeing the data and the future plans with this technology. Very interesting discussion. Thank you.
Thanks, Rodney.